This is the 6th video in my 9-part educational series about gentle touch vasectomy. This video will focus on the 2 most feared risks to having a vasectomy: vasectomy failure and vasectomy pain. Vasectomy is one of the most effective forms of permanent birth control, but no method offers 100% protection. Vasectomy is far more effective at preventing pregnancy than is tubal ligation. The most common reason for pregnancy after vasectomy is not using a backup method of birth control within the first 3 months of having your procedure. This is not necessarily a vasectomy failure, but rather more of a failure to follow after vasectomy instructions. In this situation, pregnancy is caused by sperm which have been produced and stored upstream of the vasectomy site before the procedure was performed. After your vasectomy, you can cause a pregnancy until the live sperm are cleared from their internal storage sites. To prevent the chance of pregnancy after vasectomy, it is important to use a backup method of birth control until you have been cleared by the 3-month semen sample. The second most common reason for pregnancy after vasectomy is you are not the father. It is estimated that infidelity can occur up to 30% of relationships. In comparison, vasectomy failure is less than 1%. You can do the math. The third and least common reason for pregnancy after vasectomy is because of method failure. Nothing is 100%, and the same is true for vasectomy. Vasectomy failures are not common. Vasectomy failures are classified as early and late. Early failures typically occur within several months of a vasectomy, and late failures can occur months to years after a procedure. If you are unlucky enough to have a vasectomy failure, then you should understand early failure is far more common than is late failure. Vasectomy failure is caused when the connections occur between the lower and upper ends of the divided vas deferens. As healing occurs, the body creates healing tissue, and fluid from the lower end can create small channels through this healing tissue, and these channels can connect with the upper end. This process is called recanalization. The concept of recanalization and how this causes early and late failures can be difficult to understand. I would like to explain how early and late vasectomy failures happen using an analogy of miners in a collapsed mine. After vasectomy, think of the sperm as desperate miners who have been trapped by a mine collapse. These sperm miners have limited resources, and to save themselves, they must dig a tunnel to escape their collapsed mine. If the mine collapse is caused by soft dirt, then the sperm miners should be able to dig their escape tunnels in a short time. They should be able to break through to the other side and rescue themselves quickly. Early vasectomy failure is very comparable to miners digging tunnels in soft dirt. Early vasectomy failure happens more commonly than late failure because after a vasectomy, the body creates soft healing tissue at the vasectomy sites. Healing tissue is soft and easy for fluid and sperm to push through. Most early vasectomy failures will happen within months of having the vasectomy and can usually be detected within the 3-month sample. If the mine collapse is caused by solid rock, then it will take these miners much longer to break through. Most of the miners will not be able to escape. Many will run out of time and resources and never make it. In some rare cases, a few may be able to save themselves, but it could be months or years before they're able to break through to the other side. Late vasectomy failure is very comparable to miners digging escape tunnels in solid rock. Late vasectomy failures aren't common. Healing after a surgical procedure is gradual. Immediately after a surgical procedure, healing tissue is soft. Later, this tissue is replaced by more durable healing tissue. If the sperm are lucky enough to be able to push through the soft healing tissue and be able to maintain these abnormal connections as the body deposits more durable healing tissue, then it is possible to have a late vasectomy failure. If the connections are numerous, then large numbers of sperm can get across, and pregnancy can happen more quickly. If the connections are small, then very few sperm may get across, and these sperm may be difficult to detect. If small numbers of sperm are able to get across, then pregnancy may never happen. Or small numbers of sperm could get across, collect over time, and if intercourse happens at just the right time, then there could be just enough sperm to cause a pregnancy. Minimally invasive gentle touch vasectomy using coagulation and fascial interposition is designed to provide the lowest chance of vasectomy failure. During a gentle touch vasectomy procedure, each vas deferens is divided, light luminal coagulation is applied to the upper end, and the divided ends are separated slightly by diverting the lower end and placing healthy tissue between the two ends. This tissue is held in place using a small titanium clip. The lower end is allowed to remain open to minimize the risk of after vasectomy pain from pressure buildup and engorgement of the epididymis. By leaving the lower end open, it allows the formation of a small granuloma where sperm can be recycled after the vasectomy. The chance of early failure after an open-ended gentle touch vasectomy with coagulation and fascial interposition is 0.3% during the first several months. After the 3-month semen sample confirms the absence of live sperm, this rules out an early failure, then the chance of a late failure causing pregnancy drops to about 0.05%. Since early failures are far more common than late failures, and because late failures are unpredictable and difficult to detect, it is not recommended to have multiple semen samples after the 3-month sample confirms the absence of live sperm. Pain during and after vasectomy is understandably a top concern for those who are considering vasectomy. During the vasectomy, some men may have discomfort during administration of the local anesthetic. With the no-needle technique, most men will describe the discomfort as being popped on the skin with a rubber band. Most men will have no pain during the actual vasectomy procedure. It is common to have slight discomfort after the vasectomy. Most men will rate their discomfort as mild during the first several days after their vasectomy. Very often, this discomfort is effectively treated with over-the-counter medications. Most of my patients do not need prescription pain medications after their procedure, and some of my patients take nothing at all. Most report being back to normal 1 week after vasectomy, but some may require more time. About 1 out of 20 men can have temporary inflammation that presents 2 to 12 weeks after their procedure. This is due to an inflammatory response to sperm. This can occur at the vasectomy site or even in the epididymis. This will often resolve in a week with over-the-counter medications and will not cause any long-term problems. The most feared complication of vasectomy is chronic scrotal pain. It is uncommon but should be discussed. Chronic scrotal pain is pain that lasts for more than 6 months after a procedure. It is important to understand chronic scrotal pain is rare and is not unique to vasectomy. This type of pain has been reported by men who have had hernia, bladder, prostate, kidney, or even back surgery. It is not common to develop chronic scrotal pain after vasectomy. Admittedly, this condition is not well understood and has been poorly studied. Most men feel no pain once they fully recover from their vasectomy procedure. A small number of men will report scrotal discomfort that lasts for 6 months or more after their procedure, but many of these men report the discomfort as minor. They acknowledge the discomfort was not there before the vasectomy. It started after their procedure, but the discomfort is not significant enough to impact their quality of life or require them to seek additional treatment. An even smaller percentage of men will report discomfort significant enough to seek medical treatment and will be diagnosed with chronic scrotal pain. The chance of this complication is less than 1%. Vasectomy is safe and effective, but not without risk. All medical procedures have risks, but vasectomy offers the lowest risk of any method of permanent birth control. Men who choose to have vasectomy can be confident they will be having one of the safest vasectomy procedures available to prevent unplanned pregnancy.